Welcome to another edition of Back Talk, brought to you from the Southeastern Studios in Mount Pleasant, South Carolina. Each episode, you'll hear from board-certified physicians as they explore the latest in medical procedures that are now helping get more and more people out of pain and back to their active lives.
What's your thoughts on robotic surgery?
So I do robotics. I think it's changed dramatically just in the time that I've been out of training, right? So, initially it was very slow and it was cumbersome and it wasn't very fast. And, I think they've improved a lot. And so the way that it's trending, I think that it's going to be a big player and it's getting there, right? So right now robotics help you position your instruments. So they help you put the screws in. The idea is smaller incision and less radiation, right? So when we're putting in screws with a wire and trying to put it in with an X-ray machine, we're getting radiation as a surgeon, but also the patient's getting radiation. Right. And so we can avoid that with the robot. And the idea is it's, smaller incisions because you can make an even smaller incision. And then it can help you connect the rod through the screws with less tissue disruption. So I think that's a big deal, especially for the scoliosis cases where you're putting in a bunch of screws. And then, it's there and it's becoming more widely available. Now you're using the robot to plan putting in your spacers or your cages. And, the next step is going to be having the robot assist you with the cutting the bone for your decompression. Right. So you can cut right up to, the nerves or the canal and you can not go into it, right. That kind of thing. That a lot of this stuff is gained with experience, right? Doing a lot of cases, you're pretty comfortable working around it, but the robot's just an extra level of security. Or if it's a complex case, or if it's like where I see it being beneficial is like redo operations where you're trying to maybe cut through an old fusion to realign the patient for a scoliosis type operation, where you could use the robot to plan your cuts exactly and cut it.
Well, like in general surgery, they use a robot, and they've been using a robot for longer than in spine surgery and brain surgery. And the surgeon will actually sit usually in the same room as the patient, but theoretically could be in the room next door or in a room across the hall doing the actual surgery, right? Because the robot is theoretically can be remote. Do you foresee a time in spine surgery where you could do remote robotic surgery?
I mean, I sure could see it. I mean, like you said, they're already doing it with the other robots in general surgery. So I see that. I mean, obviously I would want to be in the same room as the patient. So I think that's important to be close. So you can kind of, see what's going on physically in the room. And plus technology, every time that there can be hiccups, right? You've had your Wi-Fi not connect when you get home. So stuff like that. Yeah. But the robot, yeah, I definitely do see, mainly from a surgeon, perspective, just, sometimes with doing some of these real tough cases where they have a real steep angle, you're kind of standing and really kind of trying to look, and it's really tough on my neck. So, so I see that as being advantageous to be able to see easier and for my own comfort.
Right. Well, do you look forward to the day when I retire, but I'm still at home watching you do surgery and criticizing you while you're doing surgery?
That. Yeah, for
sure. Look forward to that.
Sure.
I definitely look forward to that. But yeah, no, I think the robot's really interesting. I mean, obviously there's a lot of money or interest in all these companies sort of going into robotic surgery, what we call image guided surgery. And it's pretty fascinating to think about the future and what that may bring. I do believe that it's going to be hard to replace, an experienced surgeon in terms of technical skill, but mainly judgment. Like there's so many things that go into making decisions in the operating room that a lot of times we don't even really think about it anymore because we've done it over and over and over again. But I'm sure you've played around with Chat GPT and some of the AI stuff, and it's amazing the answers that they give to complicated questions, but it's also sometimes frightening that it'll give a convincing answer to something that's 100% wrong. Yeah. And so everybody's interested in AI. What do you think about AI and surgery and medicine?
I do think there's a role for it, right? So I think that there's a role for sure. There's actually a couple companies out there that are doing AI having AI look at radiographs, like you can look at you've looked at so many x-rays and MRIs. Sometimes you look at, okay, that's what I need to do. I'll be able to put a cage in there. It's going to open up. And you just know, because you've seen thousands upon thousands of images. So you know that what you can expect just from your experience. And it's hard to tell someone exactly why you think that, but you just look at it and go, yeah, I can do that.
Right.
And I'm going to get a good cage in there. I'm going to get a lot of correction, and the x-rays are going to look really good.
Right.
But it's hard to say how you came to that. You just know from experience. Right. AI can do that, I think. And so there's one company out there that's looking at all, and they're just putting all these images in, right, pre and post-op radiographs showing what kind of correction, and they're predicting how much correction you can get at each level.
Right.
And the idea is maybe you could do some custom cages to get a little bit different correction or a different outcome.
Right.
But I do think there's definitely something to that. Because you have even a broader or a bigger wealth of experience than a single surgeon would.
Right. Yeah. I agree. I think radiology in particular, I mean, that seems like the obvious place to start with, because you can, like you said, the computer can look at thousands and thousands, millions of images, pixels, and then compare it to the report from the radiologist, sure, and develop the patterns and understand and be able to give accurate diagnoses. I think, not to beat up on the radiologist, but I think there's less judgment that's involved in reading an x-ray, and it's more of an objective process that maybe a computer could learn to do. I think, sure, surgery, there's so much judgment that goes along with, figuring out who's a candidate for surgery, who should even go, sure, to the operating room. And then once you're in the operating room, what decisions you make in the operating room can have a big impact on how the patient does, right? And or even on complications, right? So, sure, I don't know. I mean, I hear what you're saying, but I'd be a little bit nervous about, the allowing the AI to make suggestions about what should be done in the operating room.
The idea is you use it before to create a plan.
Right.
They send it to you and you review it. But that's, I mean, that's where it's going. I think that whether or not it'll really take off or it's going to be helpful, I don't know, but it's just an interesting idea of having all the data. And I agree with you on the radiology setting of it. The other thing to look at is a lot of patients have had multiple MRIs. So AI could probably quickly compare old films as opposed to radiologists going through 10 old MRIs and see how it's progressed.
Yeah.
So
sometimes our radiologists don't seem to compare old scans, do they?
Yeah. Sometimes they don't, right? It's kind of painful to go back through all their old films, right?
Yeah. Yeah. Do you do that? Do you always go back and look at the films and
I do. I go
them?
back and look and see how things have progressed over time. Sometimes the patients feel like things have changed drastically and they want to know how bad has it gotten since my last MRI.
Right.
To see, they want to know if it's getting worse quickly. Maybe they want to jump on it sooner than later.
Right.
Not just, I mean, obviously their feelings and how painful it is go into that. But, if they see it rapidly progressing, like, a slip disc where the bone's shifting on top of one of the other ones, you want to know if it's changed.
Right. Yeah. Yeah. Sometimes it's pretty revealing if you go back and look at x-rays over a few years, what you can see that you don't notice. Yeah. If you look at just the individual.
Yeah, I tell my patients all the time.
Particularly with x-rays, I find.
Exactly, with x-rays for sure. And I love it when they bring in all their old films, right? So I like going back years and just seeing, especially with the deformity stuff or scoliosis, how it's changed. Because you can see, oh, well, your scoliosis hasn't changed any in the last 10 years.
Right.
I think it'd be okay. Let's watch it a little bit longer and we'll see what happens.
Yeah, so. Definitely. Well, it's good to talk to you.
Good talking to you.
We hope you enjoyed this edition of Back Talk and learned something new. Look for other podcasts from Southeastern Studios as we explore the latest in medical procedures that are helping more and more people living in pain get back to their active lives.